across health and wider social care settings that are regulated by the Care Quality Commission.
Joining us on the show now is the Director of Social Care at the Institute of Health and Social Care Management, Adam Purnell. Adam, good to see you. Is this policy going to exacerbate a crisis in recruitment in both social care and the NHS? We need more capacity, not less.
Yeah, so it's definitely going to have an effect on recruitment on both sides, health and social. I think the care home sector are feeling that and seeing that now, because obviously this comes into effect on Thursday this week for care homes of all age groups. For health and for the wider social care settings, they have been given a lifeline. We've got an extra 5 months to really try and recruit and prepare to replace what we're going to lose with the vaccination being mandated. But it is definitely going to create an obstacle for people to recruit into their services.
Run a care home, you've seen the very, very close proximity between carers and residents of care homes, with lifting and physically assisting day in, day out. I mean, what can we do if care home staff don't have the vaccine, and thus they are putting the lives, aren't they, in danger of some elderly residents with the best will in the world?
Yeah, so I don't think anybody in social care would be against people having the vaccine. We all advocate people having the vaccine. We all want people to have the vaccine. It is one of the safest ways to prevent the spread of COVID. The outbreak we experienced in our care home, we were fully vaccinated and it tore through our home. So it can't be touted as the golden ticket. And I also think we need to take some consideration into what we mean by keeping people safe. So Sajid Javid there was saying about preventable harm, which is absolutely fine, but part of preventable harm surely is making sure we've got the workforce and the staffing available to provide the basic level care needs that these people have. So even if we try and protect them from COVID by enforcing the vaccination as a condition of deployment in social care, we need to make sure that the workforce is there to prop up the rest of the needs. We're heading into winter, so we've got flu season coming. It's also the time when norovirus is very rife. And if people are losing 1, 2, and a poll I'm running at the moment, which is still going, is saying some people are losing 5 or more staff, if they're going to be losing those people, then all it takes is a little bit of sickness and staffing levels will plummet to unsafe levels. If team members and care staff aren't able to take their annual leave, they're also going to become burnt out. They're going to be working too much. They're not going to have that time to recuperate. We've got the Made for Care recruitment campaign, Made with Care recruitment campaign, which is fantastic, but it got released 7 days prior to this mandate coming into social care, and it takes weeks to recruit and train and induct people to make them valuable members of a care team. So they're now going to be walking into a sector of overworked, exhausted, and frankly, probably beaten up carers going, I just can't take this anymore. So how are we to make this enticing for people? There is no shame in going, actually, let's just postpone the mandate for care homes until April next year alongside the wider social care sector and the NHS. It wouldn't be cancelling it. It wouldn't be a U-turn. It would just be postponing it to go, we're listening to the sector. We realise there's going to be difficulties over winter. We want to protect the NHS. If care homes aren't able to operate safely, then those pressures from that part of the social care system is only going to be transferred to the NHS. So if we want to go in on a protect the NHS angle, to protect the NHS, we need to protect our homes this winter.
Adam Purnell, thanks for sharing your views with us. You are the Director of Social Care at the Institute of Health and Social Care Management. Thank you.